As promised, I will talk about our healthcare system. Mainly is MediShield. We have a 3M system, which is PAP have set up, and they claim that it's very good. We have the Medisave, MediShield, and as well as the Medifund. Medifund is basically government subsidies for those who cannot pay for their hospital bills and healthcare bills like cancer, dialysis, and all that, right? But that is very hardly used, only for those bottom low 5 to 10% of Singaporeans. First of all, we will look into two aspects of this MediShield and Medisave, right? On the whole aspect, when we talk about healthcare costs, we always look at two things. How much do the people pay? How much do people pay for their healthcare costs? In Singapore context, there are two, right? One is from the Medisave that we have, right? And the other one is actually from the MediShield. And the other one, out-of-pocket money. That means when your Medisave cannot cover, your MediShield cannot cover, you have to come out with cash. That's out-of-pocket payment. Now, Medisave, please remember, is still our money. It's within our account, right? And therefore, when we look at this perspective, we always look at how much do the government contributed to the healthcare costs of the whole nation, the whole Singaporeans' healthcare payment. We are so far one of the lowest, right, in terms of healthcare cost contribution by the government. For example, I've read some articles. It compared Korean system, Taiwanese system, Malaysian system, and our system. Now, what are the difference between these four countries? Korean system and Taiwanese system is basically a insurance system, full insurance system. But Taiwanese is universal insurance, while Korean system is a bit complex, but it still pays for a certain percentage of their healthcare costs. While Malaysian and Singapore used to have what we call the national health system. What does it mean? The government actually built out the whole structure of hospital and finance most of the healthcare costs by going through the polyclinic and the hospitals. It is actually the Commonwealth system, which we have a root heritage from the UK system, the NHS system, they call it. But Singapore started to deviate from that, while Malaysia is still using that system. We are somewhere neither here nor there, because PAP government have this concept that they want to shift most of the burden of the healthcare costs to Singaporeans and cut down the government involvement or the contribution to the healthcare costs. By doing this, first, they are afraid that you cannot pay for your healthcare costs. So they compulsory make us to have Medisave. So at any point of time, they will make sure that you have money. As long as you work, you have money to pay for your hospital bills, your outpatient treatment, right? This is number one. Then they set up the insurance system, which is a MediShield system, MediShield Life, right? That is also by your money, not the government. In fact, there's a surplus in the MediShield system in 2010, from 2002 to 2010, out of $2.6 billion contributed by Singaporeans and PRs. The payout is only about 1.6 billion. So they have actually a surplus of about slightly less than $1 billion. But this money is not government money. So the government contribution to the healthcare cost of all Singaporeans and PRs is only about 36% or less than 40%. The latest figures I do not have, but that's the figures that I have for 2010, 36%. Compared to Taiwan. Taiwan government paid about 80% of the healthcare cost. Korean government paid about 55%. Right? And the Malaysian, even the Malaysian paid higher than us. Let me take a look. Where I have a chart here. I will put up these articles later on. You can see the comparison. Right? Now. Okay. Public share expenditure of healthcare, 2010. That means public share means the government share. Right? For Singapore, it's 36.3% in 2010. Malaysia is 55.5%. Taiwan is 65%, sorry. 65%, but there's a remark down there. And South Korea is 59%. So, ineffectively, PAP government actually pays very little to take care of Singaporeans' healthcare. Right? It's all contributed by ourselves, either through Medisave, MediShield, or our out-of-pocket expenditures, cash. Right? Now, what is absurd is this. We pay about 8% to 10% of our CPF, our salary, into healthcare, Medisave, which pay for our MediShield. But this amount only pays about 10%, less than 10% for our healthcare needs. That means most of this, more than 60% of healthcare costs that we bear, right? About over 50%, we have to come up with cash. This is. Why is that so? I'll tell you why. Because MediShield didn't cover normal outpatient medical bill. It only covers certain outpatient treatment, like cancer, dialysis, and all that. And most of it goes for hospital bill. This is unlike what is done in South Korea, as well as Taiwan. Taiwan is very comprehensive. Even you will see a GP, there is an insurance coverage, but not in Singapore. That's why in Singapore context, the government actually pays very little. And we also, besides of paying a lot, we pay a lot through our cash to pay for our healthcare bill. Now, why is this so? That another perspective, when you have an NHS system like the British, as a government, you are supposed to control the cost of hospital and a polyclinic because you own them, right? That is why you control the cost. You can provide cheap healthcare services, adequate services for the population. The problem is, in Singapore, we have so-called restructured hospital. Even the polyclinic, sometimes when you see that not subsidized medical bill is actually higher than the private GP. And then they'll come in and say, oh, we subsidize, that's why you pay lower than the private GP. But you actually inflated the amount so that you can claim you have subsidy, which is more or less lower, but still, your costing is still higher, right? So this is something that we try to understand why the system is so unfair to Singaporeans. When you have a restructured hospital. How can your restructured hospital services sometimes is more expensive than private hospital? That actually happens not so long ago in Changi Hospital. I think it's some testing, MRI, which is more expensive than private hospital. This is something that Singaporeans have to look into. Why is that so? Because they pay very high price for their CEO of all these hospitals, their top management, right? And this is precisely why we are paying more in terms of cash and Medisave and MediShield, through MediShield. Where Singapore government didn't really play up to a first world country's responsibility. Now, if we compare to the Swiss standard of living, right, we are even paying more per capita, right, in terms of healthcare costs than the Switzerland. People in Switzerland, we are the top actually. There's one article that says that in 2017, not so long ago, okay, how much are we paying? We are paying about 2,400 US dollars per capita for our healthcare costs. We are the top. Switzerland, let me see. No, sorry. US dollars is 2,219 Singaporeans are paying. And Switzerland, these are based on my purchasing power, PPP, not my party, but the purchasing power parity basis. Switzerland is second at 1,734. While United States is ranked a distant third, $1,039. And they are saying that our 3M system is so fantastic. Something went wrong. This is something that we have to question the PAP government. Where are your priorities? And it's absurd when your MediShield didn't cover outpatient, the normal GP bill. Why? Prevention is better than treatment in healthcare. If the GP cost or polyclinic cost is so high, and people try to avoid to go for their checkups and all that before they are hospitalized, then the healthcare problem will be more serious before they actually seek treatment in the hospital. This is part of the reason why I think this MediShield is actually cracked. Whatever it takes in every year as premium, it pays out, the payout is less. The government doesn't put in any money inside. It didn't need to actually subsidize, so-called, unlike in Taiwan. Taiwanese government have government hospital, but most of it are private. Most of the treatments are done by the private clinics and the private hospital, but they control the cost because they have a list of drugs, how much you can claim for the list of drugs they have, procedures and all that, and they control the cost by setting prices. The government will set the prices, and that's why the healthcare cost is so affordable in Taiwan for the people. And the insurance also covered the private hospitals and private clinic. But Singapore, private hospitals are covered, but with limitation. Now we come to the specific. In Singapore, we have these limits of claim from the MediShield. Limits of claim. That means, for example, you are going for a chemotherapy, per year you can only claim up to $3,000. No, per treatment. And there's something called co-insurance payment. Beside the deductible. After the deductible, you still have to pay a certain percentage for the claimable amount. And there's no limit. actually there's no limit to that. It can from 3% to 10%, but as your claimable amount is going higher, there's no limit how much you are going to pay, right? But there's a limit for you to claim for the MediShield. Every year, you can claim up to $100,000. Right? Of course, the list of claim down here that you see, is it adequate? Well, for normal ward, $700 per day, right? Intensive care unit, $1,200 per day. Community hospital, $350 per day, so on and so forth. Chemotherapy for cancer, $3,000 per month, not per year, right? Kidney dialysis, $1,000 per month. Is it adequate? No. So these are the limitations of a MediShield system, and that's why they always have surplus in the MediShield system every year without fail. I have not seen PAP government complaining that they have a deficit in the MediShield system insurance, right? Now, beside that, Taiwanese have this comprehensive universal Medicare insurance. It covers not only the Taiwanese, but also the foreign workers, foreign citizens who stay in Taiwan and work in Taiwan. Now, we are coming to an aging population, right? So the idea of having more foreign workers in Singapore is to supplement not only our labor, but to supplement the funds that we need to take care of the aged. The fundamental question is this: if the foreign workers that comes into work are much younger and presumably have less health problems than the older population of our citizens, why didn't they be included in the MediShield? Because in the pool risking concept, in the insurance concept, the more you take in who are presumably more healthy, right, because they are younger, will actually benefit the whole system. It's a cross subsidies to our population, our aging population. But this is not done in the MediShield system, MediShield Life. We can provide MediShield, not Life, but MediShield for those who work in Singapore. Compulsory for anyone who works in Singapore. They have to pay a certain amount from their salary for this MediShield, contribute to the fund. And they actually enlarge the funds so that it will benefit our aging population. The concept is very, very clear. That is exactly what Taiwanese is doing. Right. There are many things that can be done to the Medicare, MediShield, Medisave system. And the Medisave also have surplus every year. Right? And the absurd thing is this: if your personal Medisave is not enough for your Medicare, medical care, the PAP government expect your family members to use their Medisave to pay for your medical bills. For example, if your parents are hospitalized and they have very little Medisave left, or use up, so what happens? The government will not use the Medifund. They will say, okay, you have so many siblings, sons and daughters. Use your Medisave first to cover for your parents. But after they use their Medisave, how are they going to cover their own medical care when they grow old? I think this is unreasonable. Totally unreasonable. If each individual Singaporeans do not have enough Medisave to pay for their medical care, the right thing for the government to do is to use the Medifund. Instead of kicking the can down the road for the next generation, or the siblings, or the brother, or the sons and daughters of the children. Like, this is another aspect of the problems of this MediShield and Medisave system. Like, okay, I hope these points are enough for all the MPs, both PAP MPs and opposition MPs in Parliament, to have a robust discussion and debates. How to enhance the MediShield? I'm not saying that MediShield is not good. It's just that it's not good enough. It didn't covers normal outpatient treatments. It have a limitation on the drawdown, the payout. But it didn't make use the advantage of a large foreign labor's presence in Singapore. And we should look into that. Thank you.